so many exciting things that are happening in this blustery January day. Thank you for giving me a little bit of lake effect snow. I grew up in Michigan, so I miss it. I don't have it in Central Ohio. So I'm very pleased to be here, and I appreciate the kind words and kind introduction. This has been a lovely collaboration, and Erica and I have been talking about how we can collaborate and work together for quite a few years. So what I want to talk about today relates to visual attention, which I'll go into some detail. I don't assume that anybody knows anything about eye tracking, so I'll try and make it a combination of some explanation of eye tracking and why it matters for the work that we do in health and more broadly in health decision making. Okay, let me wake up my clicker here. It worked earlier, so what happened? Maybe I'm too far away. Oh, I don't want to have to stand back here. So we'll keep trying. So what I'm going to talk a little bit about is health decision making. I'll talk about the goals that we have for tobacco control specifically, because it has to do with how eye tracking can help us understand what our goals are. We'll talk about eye tracking specifically and a little bit more about the challenges and opportunities that we can learn from using eye tracking. I woke up to the clicker. Okay. So hopefully we'll have time at the end for questions. So one of the things that I probably don't need to tell you guys is that we live in a time where we just are in visual overload. We have all kinds of information that is coming at us all the time through all these different media. So we, on average, watch all this TV. We use our computers. We use our, our mobile devices. We're on the web. It's just an enormous amount of our time, and so much of that information is visual. And so, interestingly, the visual content that we perceive actually is processed by your brain so much faster than text, which is a super fascinating thing to think about when you think about how do people make informed decisions. And so health-related content is competing for space in this very, very crowded context. And so how do we use and leverage different kind of visual information to help people make informed decisions for prevention and for other kind of engagements? It's not easy to do. And so, especially when you think about tobacco control, where there is an enormous amount, and these data are older now, but I mean the amount of money that's spent on advertising and promotion, a lot of that stuff moving from traditional print and billboards and things to more social media and other spaces. So an enormous amount of money, we're going to be outspent every time. So we have to really be crafty and be thoughtful on how we can actually sort of get our message through this very noisy environment. So it's important for us to think about how do people use information, how does the brain work in making decisions. So I am not a cognitive scientist, but I will give you a little bit of background because it's helpful for us to think about how people make decisions. And so one of the things we can think about is how people process information. And so when people are making health decisions, sometimes poor choices or not our idealized choice is a result of inadequate information processing. So people might be using what we call heuristics or sort of shortcuts in making decisions. And those shortcuts might be related to people that have difficulty with numbers or have different limited numeracy, or they might have other kinds of quantitative literacy. But other problems can come from errors that people make in judgments based on the way information is framed. Is it positively framed? You can do this to improve your health versus you better do this or your health is going to suffer. And so that people can misjudge information based on the framing. So the decision quality that people make is both impacted by these internal factors that we talk about here, and we need to understand the way that your brain works in sort of processing information. So you have this quick, intuitive system that you make decisions very rapidly versus a more slow analytic system. And so our newer part of the brain makes this more reasonable analytic decision. And the midbrain handles emotion, and then your older part of your brain handles this automatic or more quick type of system. And so these should be, this is sort of a brief way to explain that our automatic or our rapid system are these kind of uncontrolled reactions, like ducking your head when someone throws a ball. This happens to me, unfortunately, a lot in my house with two balls. You don't always get a heads up. And so versus reflective systems where you have a more controlled, effortful decision-making process, which is like weighing, out a big decision about making a big purchase or doing math problems. And so your brain uses these very different processes to make different types of decisions. And so the intuition that we have helps us simplify complex choices, and that rationality helps us make more complex decisions. But humans use both of these systems in making health decisions. So we have this systematic processing, and then we have this more heuristic sort of shorthand. And so when we have repeated behaviors, we often use a more systematic process where we have one-shot behaviors. So this is relevant for those of you that might be helping to boost, people engaging in getting their flu shot. It's a one-time decision versus deciding about a more frequent decision-making, thinking about foods. It's January, it's time to think about, I'm going to make a huge change in my diet. That's not a one-time decision, that's a repeated set of decisions. It requires different kinds of thinking. Okay, so now let's talk about this in the context of health warnings or tobacco control. So when we think about the information that you're receiving from a health warning, we have pictorial elements as well as warning message information. So we have two of these processes at work. We have simple information, but we also have visual information. We're asking people to understand on a repeated behavior, but it's also an individual decision about what do I do right now? What's the decision that I'm making right now? So it's a very complex thing, simplified in a small something that's on a pack or on an advertisement. So what we know about these warnings is that the pictures help attract more attention than just text, that the images help people think deeper, more frequently, so that's good. And that the images themselves help to elicit people's emotional responses because it acts as information as a motivator and helps to spotlight people's thinking. So these all seem like very good things. So one of the reasons why I focus on visual attention is because it's the first part of this process, getting down this, if we believe in, health theory, which we do in this room, right? And we care about, this flow and processes that people go through in making decision. And attention is the first step in this series or this flow of decisions that ultimately end with a behavior change or behavioral engagement. And we can also think about the fact that many times, we're thinking about what we want people to do or not do, and that may be relevant for those of you in the audience that aren't doing tobacco control research, but that we have to attract people's attention to warnings or messaging in order for them to inform, they have a reaction that informs their attitudes and beliefs, which may change their intentions and then ultimately their behavior. Oops. So one of the things that I think that relates here to eye tracking is the fact that this table here that I just put up comes from the consumer advertising literature, but it basically talks about when people are processing information. So I'm asking you to think about, we've got this heuristic system, we have this more complex, slow, reflective system, but that people are actually giving pre-attention to content. And it's actually valuable. It's whether people are looking at something before they're really even paying attention to it, and their brains are actually getting information, which might be recognition. Do I understand what this feature is? So if you're looking at an advertisement for a product, or you're looking at the cue of a tobacco advertisement, that pre-attention is even important in consumer decision making. So this is both important when we think about the products that cue people to action, but also thinking about the simplicity of warnings, that even small amount of attention can be informative to people's decision making. But in order for people to process information, so to go through this process, you've got to attract their pre-attention. They need to then focus their attention to really look, identify words. They need to comprehend what those words mean, and then they need to cognitively elaborate about it. Think about how this means for their life. So it's a very complicated process. So when we think about, why is it important to just get people to look at things, it actually is because it's allowing them to process that information to help make health decisions. You had no idea it was so important to just look at stuff, even for a tiny period of time. So the visual attention that we spend is oftentimes very task-oriented. I'm going to make a sandwich, so I'm going to go to the place where I can have the materials to make a sandwich, or whatever. So we fix our eyes on the task at hand. But there are some decision scientists that actually suggest that the environment is also providing us with cues. Because I'm going to make a sandwich, ooh, that soup looks good. Maybe I will do that instead of making a sandwich, and I'm going to change my mind. That's a bidirectional relationship. So this is important, that we don't just function on like, I'm going to only look at the things that I need to do in order to perform my task. The environment is also cueing me with information. So that ends up being important. So the reason why it's important for us to think about visual attention, because consumers actually use information from their environment to help inform their decisions, whether they're choosing that task, like I'm going to quit smoking today. That may not be what someone's task is, but they can take in those cues from their environment. So we also know a lot about how people use visual cues. Remember that whole point about how your brain processes visual information much more quickly? So people follow that information very quickly. They follow the cues within a context. So when you look at an ad or you look at a scene, you're able to visually kind of follow what's happening. People use text and read it in a very predictable, it's called an F pattern. I'll demonstrate that in just a minute. But eye tracking research helps us to understand sort of the factors that will attract people to visually attend to content so that they can understand and begin that process of informing, making informed decision making. So we do have advertising to thank because they really know how to attract people's visual attention. They've tested this very thoroughly to figure out how you'll look at that ad and think about that brand and think about buying that car or buying that food item. So eye tracking. So you're thinking, why is she talking about all this theory stuff? So we're here to talk about eye tracking. It's actually been around a lot longer than I even realized before I got involved in this process. So the first eye tracker was built in 1908. And the research kind of really had its moment in the early 70s and 80s where it was really growing. And then the scientific community as well as the business community got much more engaged in the 2000s. And now we really have this space where we have both static content. I'm going to talk about this in a minute. But static would be things that don't move, like looking at an ad in a magazine. Whereas dynamic content would be like a commercial or social media, where things you might launch a video on your Instagram feed. Showing someone doing vape tricks or whatever it might be. So we have the ability to look at both static content and dynamic content with our technology. So this is one of the early eye trackers. I don't know if you can see this. It looks like someone's getting tortured, but there's this gentleman looking on this screen, and he has this, very elaborate thing to keep his head in place. That was looks like you really want to be consented before you, agree to do that study. But more commonly now, sorry, my clicker's going wild. We have different kinds of modes. This is a more traditional eye tracker where essentially it looks like someone just looking at a computer screen. What you can see down here are actually illuminated infrared lights. This is a little bit older tech, but that was like an earlier eye tracker. Now we've got these mobile glasses that look like you're going to maybe go do some work in your shop, but it's basically got eye tracking equipped on goggles that you can go into a space. It's used a lot in consumer research. And I have to say, I actually went in the summertime and did a virtual reality eye tracking project. There's a team at in College Park in Maryland that was doing a really cool virtual reality project with eye tracking in a virtual hookah cafe. Very interesting stuff. So there's tons of applications that you can use for this technology, lots of new advancements. That that money can buy very expensive equipment to do. So how does this work? So your eye movement is actually captured by this near infrared light. It creates a reflection off of the cornea, and that reflection is captured by the camera that's on the device itself. And then they use complex algorithms to detect the precise movement of your visual gaze based on that reflection during the time that you're exposed to a specific stimuli. So basically, here's what's happening. This is the little corneal reflection, and that's how the magic works. It's basically just these algorithms based on the reflection that's coming off your cornea when you're looking at something on a screen. It's fairly amazing. And so this is how an illustration of how the mobile goggles work. It basically has that infrared camera just built into the goggles itself, which is pretty interesting. So one of the things that so that's how the eye tracker itself works, but then how do we understand the information it's giving us? We deconstruct stimuli or content into different areas of interest. This is work by Andrew Strasser. That was one of the first sort of tobacco control applications of eye tracking back in 2012. When they were looking at these different areas of interest, he was interested in warnings with pictorial content versus textual, and you can see they've got these numbered areas. Those are the areas of interest that they drew on this ad when people looked at it. And then you can use the eye tracker to capture how much of the time was spent looking in this area versus this area, and you can see how many times they went to go visit those areas, how much total time measured in milliseconds that people spent looking at it. And I'll show a bunch of examples of that from both my lab and other labs. So I've already alluded to this. We can look at static content, that is like the one I was just showing you, where you're looking at a print ad. You can look at dynamic content. We just did this actually with a vendor. A really cool project where we were looking at people looking at their own native Instagram feeds, and we used content insertion software, very big brother, where basically we inserted e-cigarette advertisements into their own Instagram feeds to look at how they attended to that visual content. So some of them had videos, some of them didn't, but people were scrolling through their own feeds and looking at some of the content we were testing. So that was a very dynamic application of eye tracking. Very cool stuff. We can look at those areas of interest. I was just showing you an example of that. You can do all different shapes, very precise shapes around the content that people are looking at. And then what we're capturing is their dwell time, which is measured in milliseconds. You can also measure the proportion of time that someone looks at something when you show them a fixed image. You can look at the saccades or fixations, how many times did people sort of move their eyes between content. And then another thing that we are many times interested in, how long before they looked at this element. So it might be the tobacco product. It might be the flavoring information that's shown on an advertisement. It might be the warning label. Did they look at that first, or did they look at it second, third, fourth, whatever? So lots of cool information that you can capture. So here are some illustrations of the kind of visualizations that we can get from eye tracking. So this one in the upper left should be a video. Let me see if I can launch that. So this illustration is a heat map. So you can see the colors are kind of burning in. This is basically showing where people are paying attention as time is passing, if you can see that in the upper left. So that was a study that we were looking at, how people pay attention when we make warnings bigger. In this, so this is a fixed heat map. This was using mobile glasses, looking at content of where to place beverages in a beverage cooler, like in a convenience store. In the upper right, this is a gaze plot. This is a very busy plot, but this is one of the visualizations you can get, basically showing the sequence. So if I'm interested in what do people look at first, and how much attention they're paying, these are actually, you can't tell, but these are all numbered, and the size of the circle shows how much time people are spending looking at those spaces. So many times we're interested in how people are actually, like where they're looking first. This was actually in a business application, so it was like the login information for the site was over here and so on. Like, where do people find the information they need? So this last one is a bee swarm plot. What you can see right here, it's paused. These circles represent individual users. So I'm going to start this in a second. Hopefully there's no sound. But it's actually a commercial, and it shows you what you can see within a dynamic. This is a commercial from Super Bowl a couple years ago, so not an eye tracking application. So you can, we get sound. It's a Oreo commercial of people in the library having a battle over it. But you can see where people are looking as they're looking at this ridiculous commercial, but you can see what people are attending to, what they're paying attention to in that scene. Like I said, kind of a ridiculous example. But there's a lot of interesting eye tracking applications just and outside of the public health and prevention space in product placement in movies and other spaces. How much is too much? Because we've all been to that movie, Jurassic World, where it was way too much product placement, and you're like, oh my gosh, this is like a long-running commercial for Audi or whatever the car was. And so people get irritated by it. There's an optimal placement of these things. Okay, so eye tracking research in tobacco regulatory science. Back in 2016, I participated in a review looking at what kind of literature, what kind of studies have been applied to tobacco regulatory science, and at that time there were 18 studies that had really predominantly focused on health warning label research on tobacco products and ads. Primarily looking at whether or not people remembered the warnings, did they have better recall of the larger warnings or the graphic warnings. But there wasn't that much. One of the recommendations that came out of this paper was that we need to do more work focusing on risk perceptions, attitude, and of course behavior change. That pertains to people's visual attention. How does it help inform people's behavior? So I just wanted to present from a handful of different studies. Some are mine, some are not mine. The types of things that we can capture using eye tracking, because hopefully if I've convinced you that there's a valid reason that we need to understand why people pay attention to things, how it informs decision making, so I just think it's valuable to look at some different applications to think about different different ways that we can use eye tracking in this context. So in this study, this was the ad that I showed you, the traditional Marlboro man that had broken into the different areas of interest. What they found in this study was that people that were exposed to the pictorial warning had a much greater recall of the ad content versus the textual warning. And then they were also able to confirm that the time to first view and their overall time was associated with better message recall. So, or better recall of the health warning message. So not only did people remember what they saw visually, but they also had better recollection of the text information. And at the end of the day, that's pretty much what we're interested in, is do people have the information to help inform their decision making? Because usually the picture doesn't tell the whole story. So when in this particular study, they were able to examine what time people spent just looking at the warning itself, which is one of the things we're trying to do, is how do we make the warnings more visible and attending to. So this is a study from my collaborator, Olivia Maynard, at the University of Bristol in England. She's done a lot of really interesting work looking at using eye tracking, looking at plain packaging, because in the UK they are a little bit further ahead of us in terms of the kinds of things that they're doing. So they were looking at attention to brand information when there was warning information present. And so they had weekly smokers, never smokers, and different experimenters that they were looking at how their attention when they had a branded pack versus a plain pack. Folks spent more time looking at those warnings, and the eye tracking information was able to confirm those relationships. So this was from a pilot project that we did that Erica and I worked on, looking at visual attention to different product attributes in cigarillos, looking at the packages. So what we were interested, this was among non-users, we were just doing a pilot to look at some specific products, but you can see on this heat map where people are paying attention, a little bit on the warning, pricing stuff up here at the top, and then a lot of time spent looking at I think the next one I had, this was the flavor information. So tons of time, visual attention, focusing on the flavor information for those. So just as an aside, as a little pause in here, I had a really interesting conversation at a health warning label meeting with someone from FDA, and he made a really point that stuck with me since this time, that when we're doing tobacco regulatory science, which isn't the space that all of us spend time in, but in particular in that place, we aren't just doing, we have different audiences. We have our scientific audience where we're trying to quantify how many visual attention in seconds and convince people that we have robust study designs and we can make appropriate conclusions from them. But we also have an audience of decision makers who are non-scientists most of the time. And they don't necessarily have the tolerance or interest in sort of why we can't prove things doing science, that we just provide evidence. And one of the challenges that can be met by eye tracking is it passes what I call the face validity test. Do you believe that this information is valid and represents how it is that people act? Unfortunately or fortunately, eye tracking passes the face validity test for non-scientists. They're like, I believe that. That tells me something about people paying attention to, flavor information, whereas our survey data, which is, we spend an enormous amount of energy and rigor, and there's a lot of, scientific basis for it, is less compelling to people because non-scientists don't necessarily understand or value it in the same way. And so it's a very interesting tool in this space where we have to convince judges and elected officials who may not have any foundation in science that this information is valuable. It's an interesting part of the things that we do because we have this whole audience of non-scientific folks that may be ultimately making decisions. Okay, I digress. So another thing to share, this was a project that I did, timing is everything, and this was very poorly timed. We looked at warning labels related to the originally proposed FDA warnings, the original 9 warnings that had the 1-800-QUIT-NOW number on it. And one of the questions in our study that I was really interested in, this was in 2012, 2013, one of the questions I was really interested in, does anybody look at the quit line? Does anybody look at that? We have the ability to look at that question. Does anybody look at it? This is a focus map. It's the opposite of a heat map. It shows you where people look and blacks out where people don't look. Here's the quit line. So what we found was that people spent 1% of their viewing time looking at the quit line information, roughly 0.02 seconds looking at that. So less than 10 people recalled when we asked them, what do you remember about the warning you saw? 10 people out of our 200 people said the quit line. So this was not of interest to people. Now, when we got ready to write this publication up, they decided we're going to remove it from the subsequent warnings, and so we said, well, we've got actually evidence. They'd already made the decision, but it was an interesting element that you can't just throw things onto a visual space and presume that people will actually look at it, attend to it, and do that whole process of things. So that it's an important thing to remember that just putting that information up there doesn't mean people will attend to it, retain it, and do anything with that information. Okay, so this was also from that same study. We were looking at, this was what we were interested in doing, was looking at does size impact people's visual attention to health warnings on advertisements. What we found in this study, because we weren't just interested in all users, we had a particular interest in health literacy, and that was one of the things I had interest in because we didn't have a lot of evidence from the literature whether or not health literacy would draw, people with lower health literacy would be more drawn to look at the image versus the text. Because it is possible that people could look at the image to be like, tell me what it is that I need to learn from this warning, or they could look at the text and study it, because if they also have limited literacy, they may spend more time on it. So we weren't exactly sure what was going to happen, and no one had looked at this. And they hadn't tested any of the health warnings with a low literacy population. So we were interested in this. So we found that for every 1 point increase in someone's health literacy, we saw that the amount of time they spent on the picture increased by 1%. So it was an interesting finding. Like I said, we weren't exactly sure if people would spend more time looking at the picture versus more time looking at the textual elements. So this is one little sub-examination that we did in our study, but we were particularly interested because we suspect that there's a lot of our smokers that have lower health literacy, and we're asking them to do this very complex thing of taking information from visual, from textual, inform a very complex set of decisions. So we wanted to examine this in the context of health literacy. So another study, I know I'm throwing a lot of studies, I'm just trying to illustrate different applications of how we can use this technology and help to inform regulatory science or other things. So in this study we were looking at how to communicate to consumers about harmful or potentially harmful constituents in tobacco, aka ingredients. So FDA funded us to do this work to find out how should we disclose ingredients to consumers. So we built two different websites, one that had pictures, one that didn't. We didn't include any sort of amounts of, this many milligrams of these content. We just included the substances and then pictures of how they might be used. Because we were interested in whether or not people spent more time on the narrative elements versus the textual elements.
Are they identical, just real quick, they're the same exact?
They are.
Okay.
Yep, they're exactly the same. And we selected, we actually looked at the literature because some of the constituents people are more familiar with, although it's actually not super high, the knowledge of what's in cigarettes, since the ingredients have never been disclosed in all the history. You know what's in your granola bar and whether it has gluten, but but you don't know what's in cigarette products. Everything has gluten, but yes, these are identical. Just the inclusion of imagery. It was a website where you could click on the image and it would go from black and white into color, which you can kind of see here. So anyway, so what we found in this study was that people had a greater improvement in their knowledge of harmful and potentially harmful constituents when among the text-only condition. So it was a surprise to us that people actually did better in this condition. But if you look here, people are reading. Remember I talked about that F pattern? Mm-hmm. Basically people were studying and just sort of reading it, and they were distracted by the presence of visual information in this context. Now we, again, weren't studying amounts, we weren't studying more specifics, we weren't studying health risks or other things. So so we were a little bit surprised that that was the conclusion, that text did better in this time period. But we only looked at knowledge. We only looked at their knowledge test. There's a lot more that FDA needs to do to understand how consumers can better understand the ingredients in tobacco products. I'm going to skip over this one. I did want to just talk about the fact that there are also applications in the anti-tobacco context. This is from another research group where they were actually looking at the placement of anti-tobacco ads in different spaces in like a convenience store. So if they put it on the beverage cooler, if they put it on the point of sale, where did they see any differences? And they actually didn't see any differences in the locations, but the amount that people were looking at the content actually depended on the content that they actually had in their in the advertisement itself, which was a surprise. I think that it was really the emotive elements, the graphic elements, or the benefits of quitting. So back to one of the earlier things that I talked about, the framing of the information, the way the information was conveyed, ended up actually drawing more attention from folks. Okay, so to bring it back and make sure that we have some time to talk a little bit about all of these things. So we really have, we have the ability to use eye tracking as a tool. This is a relatively new tool that we have that we can apply to better understand some of these different elements that advertising has been using for a long time, to really understand how we can communicate to consumers to attract this process. So this is the level of consumer involvement to make sure that we can attract their attention, that it allows them to help, focus on the content that we're providing them with so that they can comprehend it and use it for health decision making. I don't think we've necessarily tested. We unfortunately, I think many times do what we did with the quit line and just kind of fling things up there. Let's see what happens. Can't hurt. It actually can. I think we need to do a bit of robust testing, especially for things like packs, warnings that go on packs, and things that require an act of Congress to change. We need to actually be really thorough in the way we do this application. It may not be accessible for the brochure that we make for, the quit line in our community, but we really need to be thoughtful in order to attract people's attention, because if you don't get that initial attention and they just, scroll past on Instagram or they don't see it, you've missed your mark. So we have lots of challenges in this space. Certainly, being outspent by the industry enormously is one part of it. But the connection between visual attention and meaningful behavioral outcomes, is an interesting challenge, because it isn't just, like I said, where I'm going to decided to make a sandwich and I'm going to go in the kitchen and nothing is going to prevent me. We are taking in information all the time in our environment and informing our actions. So it's very difficult to say that ad that I saw, or that brochure that I saw, or that thing, that bus, placard that I saw is going to be the one salient event that I'm going to retain and make a decision. It's a complex set of things that informs those behavioral outcomes that we're so interested in doing. It's the curse of the prevention work that we all do, that it's many times so far upstream that there's a lot of different factors that go in the chain of command. But I would argue that we can build the scientific, evidence to help make it relevant, at least in tobacco regulation, that that this early visual attention is actually really critical. So one other thing that's specific to eye tracking is that there's a lot of constraints for us to do collaborative work. I led an eye tracking work group when we were at TCORS, the Tobacco Center of Excellence of Regulatory Science, and I tried to facilitate some collaborative science across the sites. That there were a handful of other folks doing eye tracking, and there's a lot of challenges with standardization and reliability across instrumentation and populations and other things. So we can't necessarily just say, oh, let's all use the same set of items on our instrumentation and we'll go implement our projects independently and then get together and pool the data. So it makes it very difficult, based on the proprietary software as well as just the technical elements of the work that we do, that right now we can't do sort of multi-site projects, which we'd really like to do, but we're not at the point where we can do it technically. We also, this has been my little challenge that I've been trying to overcome, that dynamic content analysis, so that those vaping trick videos on Instagram or other commercials, movies, using those mobile goggles to go into the convenience store and see what it is that people pay attention to at the point of sale or other spaces. The analysis of that is a beast. I'm an epidemiologist. I'm familiar with beastie analysis. It's not that I'm afraid. I mean, I did like econometric stuff in my dissertation. Don't ask me to talk about that, but I mean, I can do it. I'm capable to do it. It's horrible. It's really a beast to do, not only from the analysis perspective, but from the, right now, we're really limited in the way that the data come in, because essentially it's a frame-by-frame analysis. Those cool visuals that I showed you, that's great for qualitative summary. Quantitative summary is much more difficult because you have each of you, if I released each of you with goggles into the 7-Eleven, you'd all look at different kinds of things. So what's the standard element that everybody looks at, and how do we capture that information from the real world environment? We're not there yet. The analysis is really kind of rough. So we're stuck with not necessarily real world. We're doing it more in a laboratory, which has its constraints. But so there's pros and cons. Believe me, I'm working on this issue. Then there's the high cost of equipment. It's come down over time, but essentially an eye tracking setup is over $20K and goes up from there. So most people can't just dig into their pocket and pull out the money to buy this equipment and then maintain the software and analysis and do it. So it's actually limits the ability to, everyone is not going to be able to buy the equipment because it requires a large investment of resources. So there are also opportunities that I think are available. I think that there are more tools that are allowing us to do research in the naturalistic environments. I'm very excited in the collaboration I'm doing with Erica. We have a new vendor for the eye tracking software that I think will allow us to improve on the sort of analysis side. And if I find that in fact it is going to, they promise you lots of things. If it does deliver on that promise, I may be ready to get the mobile goggles and go into the environment, which allows us much more exploration into naturalistic environments. And so if we're working with youth, if we're working in communities, that's absolutely essential because it better replicates what it is that people are really being exposed to in the real world versus coming into my lab and creating kind of a fake space. It has its advantages from a design perspective, but it has downsides in the realistic, naturalistic way. But one of the things that is nice about eye tracking is that I was actually just reviewing a paper that they had a mobile van that had like 5 eye trackers set up, and they went to the communities and sort of parked outside the library and had people come out. They had kids and adults, and so I mean there are improvements in being able to get to populations that may not want to take 3 buses and 2 transfers to get to the office and go to do your study, so that we can bring some of the work to the people, which I think allows us to have access to other populations. We did that when some of the study data that I was sharing on the warning label size study, we did half of the, we did that work in Appalachia. And so we were down in communities where they wouldn't necessarily have setups to do eye tracking. So I think that the opportunity for us to really get the gist from qualitative information, so those various videos that I showed you, that gist information of like what's these, where are people paying attention, like that flavor and the cigarillo ad, like you get the gist, like people pay attention to the flavor information. That's actually very valuable information to help inform subsequent projects and actions. And so I already mentioned the face validity, but that's a really high, key, important decision for those of us working in a regulatory space where we've got these decision makers that aren't scientists and don't necessarily appreciate the challenge of proof in the scientific community. So we have some opportunities, I think, that allow us to leverage this tool to help, provide information that's understandable and meets that test for those decision makers. And I will say I didn't present a ton of those, but there are some new methods of data visualization to help, that picture that helps you really understand and get the gist. That is improving all the time, which is great. So I've asked this question a lot in eye tracking. So is it really the picture that's worth 1,000 words, in particular in tobacco control? So I don't know. I'll give you the academic answer. It depends. I think that interdisciplinary research is really the key to help us understand and improve this work. You leverage this tool, at least in tobacco control, to help us understand behavior change. And so I think it's critically important for us to really rely on theory, use it to our best ability to help leverage and use these tools to really advance behavioral health and behavioral science, because I think the role of this visual content and other kinds of information in decision making is critical, and I think this allows us to make a good case for it. these are some of the project teams that I work on that are contributing to this work, so I'm very grateful for all their contributions to the work that I do. And we have a couple minutes left for questions. I appreciate your attention today. Don't be shy. Yes.
I think this was so fascinating. Thinking about the health promotion side and like what you've learned from eye tracking, like, do you have suggestions or thoughts about how what you've learned can be translated to those of us who are trying to promote health? And, you know, like, I've learned so much just from sitting here today, but then going back and being like, all right, when we're sharing out our information and our data briefs and we're trying to tell the community how to be healthy, like, what is, like, easier ways that we can share this information, how we should be marketing our information or visualizing our products to help people, given that you have like the mammoth people are facing and all the money that they put in, and like many of us don't have a marketing person or dollars for marketing, and that's like such a challenge. It just feels like overwhelming.
Yes, I do understand that. Actually, this is a topic that I've been spending a lot of time thinking about, and because I realize and recognize, like, not everybody has an eye tracker to do all of this stuff, but you still have, so there's kind of two things. I think on the very front end of the work that you do, I think we can still do the good old-fashioned pilot testing, because I think that's actually very valuable to get with your community, who's your target audience, to go through that process to say, does this make sense? Is this the kind of information you want? Is there a better format? Is there a better way to deliver it? How do your neighbors and your aunt and your cousin want this information to be received? So I think you can still do a lot of that preliminary work in order to attract people's attention. You can find a lot of that core information that you can still get from your community. And then on the other end, one of the other spaces is people are visually overwhelmed, but that doesn't mean we give up on sending the messages. I think it's actually really critical for us to be spending the effort and trying to get our messages out there, because that's where people are spending their time. So one of the things that I tell my students in class, I have them do this activity that I call a dissemination challenge, because we aren't always the best about disseminating our information in formats that people want to pay attention to. We spend too much space. We put it up on a PDF on the website and say, everyone's going to look at it and download it. Nope, they won't, because they need to know about it through social media channels. You need to share with partners. You need to communicate. You need to, so the dissemination challenge is have a set of people write in 120 or 200 characters with at least 5 hashtags, ready to go. And have people put those things together and figure out what are the key messages, have somebody paying attention to those things, because that's the space where we're going to get the biggest dissemination, biggest bang for our buck to communicate those things. And there are different ways to package information to those audiences and communities, and you have to really be attentive to that to the best of your ability, even if you can't, bring them into the lab and have them make heat maps. Yeah.
So how connect another dog? 'Cause I'm sure this is, the validation of this is often in the marketing data, right? So how do you know that then, I know that it's where people look, but then how do you know for sure how that translates into the behavior? You've got the knowledge, I can see that piece, but like, how do you know what, does looking at those flavors mean they pick it? Like, do you guys do that with regular non-flavored?
Yeah, so some of the things that we're going to be looking at will be in this upcoming study where we've got eye tracking built into the design, is we're going to be looking at flavored advertisements and looking at preference. I don't know that we have follow-up built into that, and so we will be following up with them. I mean, so as I said, it's difficult when we're talking about an environment where, if you think about the effect size of, exposure to a flavored advertisement, it's not going to be 100% of the reason that I go into the store and buy that product. But that cumulative exposure, the interest in that, the look of the ad, the brand, all of these things do factor in. So it's hard to tease apart something that isn't the strongest signal that's going to be out there, but we're building a case to the fact that if they don't look at it, they're not going to have the same degree of interest in it. So in this case, if we're looking at flavored ads, what happens when we take flavors away, and how does that impact their interest and engagement in using that product? So it's the challenge we have in a lot of prevention work of how do we build the case for something that isn't necessarily going to cause 100% of the behavior to happen.
Has anybody done that itself? Like, look, if you think about when you go into one of the 7-Elevens and you have the full breadth of tobacco products, and does a kid who come in, do they go immediately looking at those flavored?
Yep.
And now if you took that same picture and all the flavors are gone, do they like go right past it now? Because that's, I don't know, that would be just fascinating to know what they do
Right.
once that thing that attracted their eye is not there.
So we have some data from my colleague Dylan Wagner in the college in the Department of Psychology. They did some work with storefronts and showing flavored versus unflavored e-cigarette ads to adolescents. And so they definitely didn't look at the subsequent behavior to see what do those kids go forward and do, but they certainly showed a preference. What most of this research has shown is that people recall the information. If they pay more attention to it, they have better recall of that information, which isn't like a shocker to hear, you know. But it certainly helps to understand if you're exposing people to information, whether it's flavor or pricing or brand specific, that people will recall, and it does increase their potential for use. But that relationship between how much does exposure relate to their subsequent use, we haven't quantified it. I'd love to be able to do it, but it's a hard study to do.
It's almost like you could use this natural experiment, because if in fact flavors go away, it's one thing that, you're going to use the evidence that kids are going to buy them less. But the other thing would be is if they go into a store and like they don't look at the tobacco at all, if that thing that they've been attracted to is no longer there.
Yeah.
And that'd be fascinating to see, because that's not even what they're purchasing, it's almost just what they're...
Yeah. It's an interesting space too, because it's also not going to be 100% of everybody, because some of the folks will figure out how to get it online, and if they want to get their thing, they're going to get it.
Yeah.
But yeah, it's an interesting space for sure. Yeah. Other questions?
I was thinking about tobacco use disparity of populations, and your mention of health literacy and low health literacy made me think about education and disparity of populations. Where's the state of this research or the work that you do in terms of populations who use disproportionately?
Yeah, so like I mentioned, we did our project in Appalachia, so that's where we have very high prevalence. In Ohio, some of the counties we were working in have a 40% smoking rate. So that's a particular vulnerable population. I, like I said, is interested in health literacy because I have reason to suspect that, we have folks that don't have as high health literacy that remain using tobacco products. There's certainly one of the, at least in the health warning label literature, I will say is probably an egregious example of not focusing on priority populations, because part of the challenge that FDA has in their defense is they have to design labels for everybody. But for instance, I just been speaking a lot about a project that we did this summer looking at the fact that there's been very little attention paid to the development of health warnings focusing on women for the pregnancy-related warning, like almost none. Oh my goodness. Like, so I've got a project that's going this summer looking at how do we modify those warning labels? Are there ways to make them better for women of reproductive age? So there's a lot of there's a lot of work to be done, is the short answer. But certainly in health warnings, we haven't done a lot of focus on what are the messages that will really resonate with specific communities, partly because FDA's duty is all consumers, but I make the case that for pregnant women, at least current status of biology, women are still having babies only. Other questions?
I have one question. Maybe this is the last. Does anyone else have a question? Otherwise, I'll take the last question. You touched on this very, very briefly, and I wanted to come back to it. You mentioned that, the industry has a ton more money than we do.
They do.
And they use the same get to kind of inform who their audience is and how to appeal to that group. And sometimes I worry, and I think lots of us do, that the work that we do can also be used by the industry, right, to help them figure out how to either find a loophole or, go around whatever finding that we're informing. So can you say anything about how you think about framing your work and your overall body of work in this space where the results that we find around behavioral intention, which is really where we can go in behavior, could potentially be used by the industry for opposite intentions.
So it's interesting because anytime I have my eye tracking stuff that I take to conferences, it's always the guys from Juul or industry, Japan Tobacco, that come up and talk to me. So I've gotten really good at being like, now where are you from? Before I give away all my secrets. But I do think that my very pessimistic self thinks that the industry already probably knows all the stuff that I've discovered. So that's my very pessimistic. I'm probably not giving them any sort of clue. It just allows them to figure out how they pivot. So I do think that it's important for us to keep in mind, and I think we even had this conversation a little bit earlier when we were meeting earlier today, we shouldn't be doing the industry's work for them. But I think it's important for us to think about what are the mechanisms of action, what are the things that we can actually leverage and do, especially when we think about policy. So certainly, I do think that the industry has used eye tracking. Interestingly, in both the consumer literature and in the industry, their burden of proof isn't a p-value. They're going to just do a small group. They're going to do have us get together and look at something and be like, well, that played well. Let's put it out. Let's roll it out in Cincinnati. See how it goes. Oh, pull it back in. It didn't work. Let's try it in Roanoke. And that's what they do. And they don't have to do a nationally representative sample and find, these kinds of differences. So their burden of proof is a little bit different than ours. So we have to kind of keep that in mind in what it is that we're trying to do. But I think it's also very important for us to think, how do we build the evidence to support the policy decisions, which unfortunately is a very slow process. So that doesn't totally answer your question, but I think that, I do absolutely think about it, because my goal is to not help them do their work, is to in fact inhibit the work that they do to the best of our ability. But they're so well funded, they can do this. They could have done this years ago. They've been planning out their flavor strategies for a while. I think it's just thoughtful for us to think about how do we best inform and move things forward to the best of our ability, and also improve the other efforts that we're doing, because tobacco is one part of a whole bunch of a whole set of health behaviors that are very important, that are contributing to morbidity and mortality, not just tobacco. So we got to figure out how to support one another and improve behavioral science, and use these tools to the best of our ability. So, thank you guys. Thank you.
Thanks again, everyone, for coming. Just as a reminder again, our seminar next month will be Dr. Klein from the Gun Center. We hope to see you then. And thanks for coming. Have a great day.